All right, so let's go ahead and jump into our patient here. You can see he's an adult male, and his main concern was this back tooth here was in crossbite. This is the lateral incisor. You can see it's entirely behind the lower arch. In addition to that, he had quite a bit of crowding here. And then due to his bite, he had worn down and chipped these front teeth quite a bit. So this is pretty common in cases where there's a traumatic bite. Over time, as you age into your 20s and 30s, these teeth take a lot of wear and tear. And you can see now, these are pretty chipped and worn down. So this patient was an adult. He asked if it was possible if we could do this with Invisalign. And we told him that that was definitely something we could do. So we'll show you how this process works. So with Invisalign, the first step is we do a scan of the teeth, top and bottom. We submit that to the Invisalign lab tech. And then the doctor works with that lab tech to design a plan that's gonna work for that patient. So we kind of go through how we wanna move the teeth, what attachments need to go on it, if we're gonna use rubber bands, how that's gonna work, how to stage the different trays. So you can see this is what we work with the Invisalign lab tech. And we help them and say, let's put attachments on certain teeth. You can see where these cutouts are. This is where buttons are placed. We had this patient wear some rubber bands to help with the bite correction. For this patient, we wanted to pull the bottom teeth back and top tooth forward. You can see, better visualize how worn down these teeth are. And then we'll also be able to show you where the teeth started from all the different angles. You can see that tooth is pretty far back there. And then the crowding was down there. So these little numbers here, these indicate what's called IPR, or interproximal reduction. You can see this patient, the gums didn't fully fill up to the top of the teeth, and he had what are called black triangles. So by doing what's called IPR, where we basically polish between the teeth, we're trying to help reduce those black triangles and remove them. So our plan for this patient was with Invisalign, we are going to open up this space here. You can see that space is going to widen up and slowly start to bring that back tooth forward. And so that is what we programmed into the Invisalign trays to do. Pulling that back tooth forward. We'll look from the bottom, show you what's happening down on the lower teeth. See the crowding is going to slowly resolve as his teeth came forward. And then from the front, see that tooth slowly comes forward and begins to jump over. So I tell patients that right about this stage is when it's not going to be real comfortable, because they're basically going to be biting right on top of that tooth as it jumps over the bite. But usually if you have your trays in during that period, it's not too bad. So this is what happened. This first set of Invisalign trays was about 40 trays, which is about 40 weeks, a little less than a year. And then after this first year, we saw him back and things worked out pretty much as planned. At that point, we went ahead and did what are called build-ups. You can see these front teeth are really worn down. So I built them up using a dental composite to give them a more full shape. And so we'll jump into the other ClinCheck here. So here is the second ClinCheck. So at this point, it was a little less than a year into the process. You can see we were able to get a lot of correction already. At that point, I did build-ups. So you can see the dental composite that I put down on the front teeth to help make those teeth a little bit fuller. And then you can see the black triangles that form. You can see the gums didn't fully grow in here. And that's normal as an adult. If you have crooked teeth, when the teeth get straight, oftentimes you'll have these pretty large black triangles. So we went ahead and did some more polishing between all these contact points to try to help reduce the amount of black triangles he had. And if we look closely, you can actually see some of that polishing. So you can see there's a little gap there, little gap there, little gap there. That was all to help reduce those black triangles. So the second set of Invisalign, we switched the rubber bands to help pull these canines down. You can see they're kind of floating up here a little bit, so we wanted to sock those in a little bit more. But overall, he was about 80 or 90% of the way there with the first set of trays. That's pretty normal. The first set of trays gets us a lot, pretty far down the road. And then the second set is just basically to fine tune and detail, get everything perfect. So the second set of trays was pretty minor, but it's basically just kind of getting everything locked in perfect where we want it. So the second set was about 20 trays, which is 20 weeks. So that is about 4 or 5 months. And you can see this is where we wanted to get them. Again, here was the before. When we started, you can see the worn down teeth. That tooth was blocked out, the amount of crowding he had. And here is the final photos. You can see we got a great result. These teeth have the buildups now to give them that more full look, and they weren't worn down anymore. We were able to get this tooth that was in Crossbite completely forward. And this patient, we put a permanent retainer in. This tooth is going to have a tendency to want to jump back there because it came so far. These teeth that were crowded are going to have a tendency to want to go back as well. We tried to reduce black triangles like we said. You can see he's got a little bit here, but they aren't too bad. We were able to reduce them really well. And when he's smiling in the front, you really can't see too much of that black triangle look anymore. So here are his before and afters. You can see how much it changed from the smiling point of view. And then that tooth, how far it was able to come forward. You can see the crossbite was fully corrected. The crowding was resolved as well. And from the top, you can see that tooth is in the right position. These teeth are fully corrected. This was done 100% with Invisalign. No braces were ever on his teeth. We were able to get full correction in about a year and a half or even less, I think, in this case. So this case worked out really well. Not all cases work this quickly, but in general, Invisalign, we can get similar results that we get with braces if we set it up properly using the right treatment plan. So if you have any questions about Invisalign treatment, about crossbite correction, feel free to ask them in the comment section below. We'll do our best to answer. If you're new to the channel, please subscribe for more braces and Invisalign related content. We release new videos each week about braces and Invisalign, and please drop this video a like if you found it helpful. Thank you so much for watching. We'll talk to you soon.